Now, it's such a pleasure for me to welcome Dr. Jim Kim to our results webinar today. I and Results have had the privilege of working with Jim for 2 decades, and Jim, we've missed you. It's really great to have you on the webinar, so thanks for joining us. I want to take a minute just for folks that don't know you as well, just to say a few things and that I think are important to set us up for what we're going to talk about today. But just as co-founder of Partners in Health, Jim helped put in place the first large-scale treatment programs for drug-resistant tuberculosis in Peru and Siberia, when many people said that wasn't possible. He has repeatedly shown that the supposedly impossible is possible, and he's set bold goals and he's driven the action. You know, as the head of HIV programs at the World Health Organization, he launched the first ever global goal for AIDS treatment with an aim of treating 3 million people in developing countries by 2005. People said it was impossible. That goal was achieved in 2007. As the president of the World Bank, one of the first things that he did was set a goal of ending extreme poverty, a goal for the bank by 2030, and that goal became the first sustainable development goal adopted by the countries of the world. And also, just really notably, as president of the World Bank, Jim launched the Human Capital Project to politically prioritize developing human capital, health, knowledge, skills that enable people to realize their potential, and really pushed more political attention and leadership and investments in health, education, nutrition, early childhood, and much more, and even publicly ranking countries on how they were doing. And most recently, Jim has taken leave from his role at Global Infrastructure Partners to devote his time to driving a comprehensive response to the corona pandemic here in the US. So Jim, a big welcome. It is really great to have you. And we'd love to hear about kind of what you're doing, a little of what you're doing right now and with Partners in Health and efforts in the US, and also what you've learned, you know, from your work around the world that you're applying here in the US to start.
Well, thanks so much, Joanne. You know, it's wonderful to see all of the faces. I'm in gallery view, so I can see many of you. You know, my relationship with Results goes way back, and I just want to say once again, you should all know that you've had a huge impact on so many different issues. And you know, when you guys call members of Congress, not only in the United States but all over the world, people do listen. So I just want to thank you for the work you do, and I'm honored to be a part of it. And I was even watching the final speeches there for becoming a member of the board, and they were also very inspiring. You know, Joanne, you know so well our history, and the work of Partners in Health has been to go into a situation where experts, I mean, these are the top experts in the world, say that something like drug-resistant TB treatment or HIV treatment is impossible in resource-poor communities. And you know, when I tell these stories to students, young people today, they can hardly believe that 99.9% of the global public health community said that treating HIV in Africa was impossible. And so you think about that. You know, the greatest minds. I mean, Bill Gates said about HIV treatment in Africa, he says, well, you know, with HIV, I think we're talking about the next generation. We have to focus on prevention. So, you know, and I admire Bill as much as I admire anyone in the world. What he's done in global health is just extraordinary. But he was deeply influenced by the people around him. The public health community was saying 25 million people who have HIV in Africa, the vast majority of whom don't know their status. You know, it's just really going to be too hard to do it. And this was really based on nothing. There was no large experience of trying to do it and failing. And so at Partners in Health, we were a part of a very small group of physicians who had actually tried it and had success. And you know, it shouldn't have surprised anyone, because you know, we share our humanity. And if these pills are given to people in Haiti, which is where we started, the response should be the same, because we, you know, in fact, human bodies are similar. And so you know, we did a very few cases, and fortunately, we were able to impact some really important people, like, and this was 20 years ago, Tony Fauci. Tony Fauci has been a very close friend for a very long time. And Tony was one of the few who said, look, I don't have the expertise to tell you logistically whether it's possible or not, but I believe you guys. And it was, you know, some of our efforts led to President Bush starting the PEPFAR program. You know, Paul Farmer, my colleague and friend of many years, actually went to the White House in the evening, late at night, and actually showed the before and after pictures of our treatment success in Haiti. And we understand that that was really important in changing the mind of leaders at the White House. Now, you know, I tell you this story because I never would have believed that the kind of public health nihilism, the kind of you know, you've heard about the can-do spirit. In public health, we have the can't-do spirit. And I never would have believed that that would have reared its ugly head in the United States. Now, you know, there's a lot of blame to go around. And I certainly am not saying that the public health community is the one that caused us to be where we are. Certainly there were many other, and I don't even have to say them, you know them so well. The way that, this pandemic has been approached by the federal government, especially the executive branch, has just been absolutely insane. But I got involved with this because I was also hearing stuff coming out of the public health community that was just the most painful deja vu. You know, at a point when there were no recorded cases in many states in the United States, at a point where, you know, that the community transmission had started, but we still had a chance to get on top of it. Not everybody, but certain members of the public health community came out and said it's too late to do contact tracing. It's too late to try to contain the virus. We just have all we have left is shelter in place, you know, the so-called lockdown. And I just couldn't believe what I was hearing. I thought, what are you talking about? Even if there's community transmission, if you're going to come out on the other side of it, you have to build testing, contact tracing, isolation and quarantine programs, because you know, you're never going to be able to get out of lockdown unless you have these programs in place. And so I was calling as many people as I could, and I did reach Tony. And I said to Tony, Tony, we have to do contact tracing, don't we? He said, of course. He said, in a perfect world, of course. But what I'm trying to do is just get them to agree to shelter in place. I'm just trying to get them to agree to lockdown. And if I can do that, then at least we'll prevent the disaster of our hospitals being completely overrun. And I said, but Tony, what do you think? Shouldn't we try to set up a program somewhere? He said, of course, Jim, please go ahead, do whatever you can. And so I called governors. I talked to, you know, and these are great people. Mike DeWine of Ohio, a very, very good man. Jim Pritzker, Governor Pritzker of Illinois, you know, the governor of Delaware. I mean, just many, many different people. And they got it. They understood that this was important, but they didn't quite know where to start. Right? And so finally, I called Charlie Baker in Massachusetts. And luckily, I'd known Charlie for about 15 years. And I said, Charlie, you know, you've got to go on offense against the virus. Everywhere in the world that has had any success is when they've gone on offense against the virus. This is not anything new. It has nothing to do with technology. This is just straightforward public health 101. Every single public health person gets taught that if you want to stop an epidemic, you have to get to the level of the virus and stop transmission. And so Charlie, you know, I'm not sure why. I have great respect for Governor Baker. He said, okay, let's do it. And so we started building a contact tracing program, literally as an addendum on top of the local boards of health, you know, community health clinics, the system that existed. And it was unbelievably difficult. And it's gonna be unbelievably difficult in every state in the United States. But there's absolutely no question that that's what we're going to have to do in every state in the United States. So every bit of the pathology of the American healthcare system rears its head, is right there in front of you in trying to do a contact tracing program. Testing was difficult because we go to certain testing centers and they say, well, that person is not insured through this health center. So the insurance difficulties, and Massachusetts has one of the best health insurance schemes of anyone. You know, Obamacare actually came originally as a form of scaling up the Massachusetts program, right? So every single complexity of the healthcare system came to the fore. We spent hours and hours and hours trying to reconcile data sets. And then the testing delays were so huge that you'd take a test and we wouldn't get the information for 5 to 7 days, meaning that the people who were positive probably infected everyone they were going to infect anyway, right? So it was so difficult, but we did it. We built it. And we built it at a very large scale, the largest scale that we've ever had in the United States for any kind of epidemic outbreak. And then as soon as we did that, because I think in Massachusetts, we did start having an impact, and the folks in Massachusetts are very good about wearing masks and social distancing, the cases dropped, right? And so if you read the newspapers, if you just Google Massachusetts contact tracing, there's probably 90% of them are very positive articles, 10% of them are very negative. And we've had trouble. It's not been easy at all. But if you look at every single country in the world that's gotten the virus under control, the specifics of the program are different. Some countries can do it in a more authoritarian way than others, but the common elements are absolutely the same. You've got to have some kind of a seriousness about social distancing. Masks are really, really important. But then you have to have widespread testing, contact tracing, isolation, and quarantine. And of course, you have to treat the people who are sick. It's very important because the better you are at treating the people who are sick, the higher their survival rate is. We know that for sure. So we started this program going, and Joanne, we still get attacked from some of the public health community. And they're saying things like, oh, it's impossible, it's too complicated, you can't do it. And if you look carefully at what those people are suggesting, they're basically saying go in and out of lockdown until we get to herd immunity, right? Now, herd immunity is a concept, it's what you get when you have a good vaccination program. Enough people have immunity to the virus itself so that even if the virus is present, there is enough immunity so that outbreaks don't happen, right? So, but what have we learned about this virus? What we've learned is that it prefers older people. It prefers people who have underlying medical conditions. It prefers people who have no choice but to work on the front lines. And the death rate in the African American community is at least 2.5 times higher than than for the country as a whole. In Latinx communities, very high infection rates and death rates. In Native American communities, very high infection rates and death rates. And so what we've been saying is these people who are saying, oh, don't worry, we'll get to herd immunity. It's not herd immunity, it's going to be herd culling. And the ones who will be culled are exactly the ones who always get culled. It's going to be the poor, it's going to be the communities of color. So we've got this going in Massachusetts, and I've actually talked to a lot of people. I talked to the Clintons. I talked to President and Secretary Clinton. I said, "What do you think we should do? This is just nuts." And what they suggested was try to make it work in one state. If you can make it work in one state and show that it makes a big difference, that's probably going to be the only way that you'll convince everybody that this is the right thing to do. And so we've had better luck, though, with the Democratic Congress. I've been in close touch with Speaker Pelosi and her team, and also the HEROES Act, the $3 trillion second stimulus has in it $75 billion for public health scale up. Now, if I put my economics hat on for a second, we spent $3.5 trillion for fiscal stimulus. We have done, adapted monetary policy, the likes of which we've never seen before, that's going to absolutely have an impact on the indebtedness of the United States. And with the trillions of dollars we've spent on dealing with the economic aspects of this crisis, we have spent almost nothing on public health, right? And I keep saying to people, this is not an economic crisis. It's a public health crisis with economic impacts. You got to solve the public health problem first. But and I think lots of people have gotten that message. But you know, when they look at the task in front of them, which is, oh my God, you mean I've got to build a contact tracing system now that can get to thousands of people, that can get, you know, if there are 10,000 cases, you mean I have to track 100,000 people? And the answer is yes. We have no choice. There's, you know, the existing tools are all we have now, right? And you hear a lot of very optimistic projections. Oh, we're going to have a vaccine soon. We're going to have drugs soon. Well, you know, Joanne, how long have we heard that about HIV? How long have we heard that about, you know, the various diseases that we faced? Now, you know, I would be thrilled if there were a vaccine. But just the other day, Tony Fauci said, well, we would be thrilled if there was 70% effective vaccine. Then you have to ask the question, how many Americans would actually get the vaccine, right? There were surveys that suggested that as few as 50% of Americans would agree to get the vaccine, right? So let's be optimistic, and let's say 70% of Americans agree to get a 70% effective vaccine. Well, then the overall immunity is about 50%, which is not enough to have herd immunity. So even with a vaccine, we're going to be struggling, right? So the only thing that's worked, and the only thing that you can, you know, and the reason we know this is because it's every single country that's been successful has done it exactly this way, are all these multiple pieces of a public health response that can get us to where to the best possible outcome, which is a relatively functioning economy like they have in China, in South Korea, in Hong Kong, with periodic movements back into lockdown, but fairly quick movements out of lockdown and back into economic activity. That's what we have in front of us now. I don't know why we've not made more progress on this. I don't know why business leaders, for example, have not been yelling and screaming for enough money so that we can do this in every state in the United States. And I think there's just some kind of mental block that we have. But I also have to say that a contributing factor is that a lot of public health people have been saying, can't do it. It's too hard, too complicated. So I feel like I'm with family now. And so what do we need more than anything? We need that bill to get off Mitch McConnell's desk. We need that $75 billion for public health interventions as a first step. And we need to build effective public health programs everywhere. You know, Tom Frieden, former director of the CDC, he wrote an article, said, you know, public health people are like the Eeyores of the health profession. You know, can't do it, you know, oh, woe is me, pity party. And he's right. I mean, that's what's happened here. You know, the reason that Partners in Health is working in Massachusetts is that we were the only group around the governor that said, yeah, it's really hard, but you know, we've done more difficult things. We've done contact tracing in Liberia during Ebola, right? If you think contact tracing in Massachusetts is hard, try contact tracing in Liberia in the context of Ebola. We've treated HIV in the mountains of Lesotho. So you know, this, you know, you can probably tell I'm still just kind of incredulous that we find ourselves in this situation. I don't know that. I mean, you know, the notion that the richest country in the history of the world would approach a pandemic like this state by state is just. I mean, it's something that you can hardly even imagine, right? But we can't solve that problem until November. But for now, you know, even just getting states on board has been so hard. In California, in Santa Clara County in California, Sarah Cody did wonderful work. She did the first lockdown order. She got all these different pieces in place. Santa Clara is still doing very well, but she's been attacked She's been attacked because they're saying she's too aggressive, right? And the current Secretary of Health of the state of California, and some of you may be there, wonderful guy, Mark Galley. Mark was my student. He worked with us in a project in Roxbury when he was a student at Harvard Medical School. And I told Mark very early on, Mark, it's going to be the hardest thing you've ever done, but you've got to get these contact tracing testing. You've got to get these programs going in every county in all over California. And they tried, but the epidemic caught up with them. And now California the cases are growing very, very quickly. So, you know, inside my company, I'm often told, you know, we just can't listen to you anymore, Jim. You know, they've all had, you know, we're listening to the, you know, to the newspapers and had these, you know, very optimistic projections of what's going to happen. And unfortunately, I've been right. And so they, you know, they now listen to me a bit more. But, you know, this is going to be, I don't think that a vaccine or treatment is going to fundamentally change what we have to do, at least for another year, at least for a year, and could be longer, right? And so we're just going to have to live with this notion that social distancing, these very fundamental public health measures, especially focused on making sure that poor people, that people who live 5 to a single room apartment are able to stay safe in the midst of COVID. This is what we're doing in Massachusetts. You know, in Massachusetts, we found that the contact tracing program with very strong social support is one of the great equalizers in the epidemic. We're able to find a safe place for people to go to, and then we support them so that they can eat, they have whatever they need. You know, public health can be a great equalizer, and in this case, you know, what we're in fighting COVID, we're also fighting racism in the sense that you know, the injuries of slavery, the injuries of class, the injuries of racism over so many years are embedded in people's bodies, and COVID knows exactly how to go after those weaknesses, and the only way to stop it is better treatment, but also ensuring that everyone can stay safe in the same way. You know, in Newton and Wellesley, wealthy suburbs of Massachusetts, we don't really need to be crazy about contact tracing because they just go to the extra bedroom and they can isolate relatively well, not perfectly, but relatively well. It's Chelsea where the rates are so much higher, where people are poorer, living in much more crowded conditions, where contact tracing takes on a really, really important role. Joanne, I'm sure you that's a lot to take in, but that's what I'm working on. And by the way, I haven't stopped my other job, so I'm doing 2 full-time jobs. But you know, as you know, immigrants are only happy when they have at least 2 jobs.
Yeah, Jim, I've never known you to do less than at least 2 jobs. So again, just to say how incredibly important it is that you're not just calling for this, but you're showing it's possible, like you all did in Haiti, like you did in Peru, like you did in Siberia. All the times people said it wasn't possible, and you had to show it in order to drive it. And also just so important that you're talking about when people make these decisions not to do this, who it is affecting, and how that is so linked to the, you know, decades and centuries of racial inequality and oppression. So I just want to let folks know we're gonna go over a few minutes just because I feel like this is so incredibly valuable and rich. So I want to also just Jim, because you have such a perspective on this as well, and you know, we are driving a more aggressive, equitable response in this country, but also globally. Can you say just a few words about also how we can use this moment, as challenging as it is, not just to kind of claw our way back globally to kind of where we were with public health, but to push for something that is more, you know, also more comprehensive and effective in terms of a, you know, a global public health response along the scales that we need, and that we don't also just kind of go back to how do we keep wealthy people in wealthy countries safe, but use this moment just to have a few of your thoughts on that as well.
Yeah, you know, Joanne, after Ebola, right, we thought that Well, now that everyone saw what a close call that was, I mean, what if Ebola had gone to Delhi or Karachi? We would probably still be dealing with it now. But we were lucky, and so we thought, well, everyone understands how lucky we are. I'm sure the conversation will change, but it didn't. I was Antonio Guterres and I commissioned a study about pandemics. It came out in I think October of 2019, and it said all the things that we should be doing, and nobody paid attention. Right? So now, what will happen? I don't know, but my sense is that that there will be an opportunity. I'm very worried about the situation in developing countries, but in talking to my friends and colleagues in Africa, for example, I don't think the relatively lower number of cases in Africa is just a result of not enough testing. What I've heard is that I keep saying COVID. The most important things to fighting COVID are humility in the face of the virus and solidarity, right? So you look around at the countries that are not doing well. Humility and solidarity are good sort of litmus tests, I think. In Africa, they've had so much experience with pandemics that the response was very quick and very very widespread. And so they're kind of, what I'm hearing is they're kind of more used to the social distancing, and the numbers are relatively low. One of the best COVID responses in the world is in Rwanda. And shouldn't be a surprise. I spoke with President Kagame not too long afterwards, and he knew exactly what he was doing. So it's differentiating in societies on the basis of experience with the previous outbreaks, and also based on humility and solidarity. But I mean, I think what this illustrates, what COVID has illustrated, is public health is probably going to just have to be part of our daily lives much more than we could have ever imagined. Just like after 9/11, the security measures at airports at first seemed really draconian, really problematic, and now it's just what you'd expect. I think some manner of public health measures will also be part of our lives. What's that going to look like? Well, global governance around global health is really in a shambles right now. Tedros, is, of course, Joanne, is both of our, we've both known him for a long time. He's a wonderful man. Mike Ryan, the folks who are running the response in WHO, I think they've done a good job. Unfortunately, they haven't done a great job, and they've had a couple of missteps that really hurt their credibility. Even now, the notion of aerosolization of the virus. So people have been asking me when I've been doing television shows and the like, do we need to create another World Health Organization? I don't think so, Joanne. I think we need to fix what's there. But what I generally tell people is, well, these organizations are only as strong as the member states, and if the member states support and really challenge these organizations, they do much better than if people pull away or just criticize. And unfortunately, that's where WHO is right now. Now, I think we're going to have to look at a lot of different ways of helping developing countries build back their healthcare systems. And I spoke with Kristalina Georgieva, head of the IMF, just last week. And some of you may know she was my deputy for 3 years when I was at the World Bank Group. Kristalina thinks there's no question that we have to move toward another debt relief process. Right? I think that's right. I mean, I think that if debt relief is linked to the building of healthcare systems that will prevent outbreaks like this from happening, I think it's a wonderful way of moving forward. And moreover, I think we'll be able to show that many of these countries who've experienced outbreaks before are doing pretty damn well in terms of preventing massive coronavirus outbreaks. Right? So that's a conversation I hope we can have. Now, I just don't, so much of this stuff has been led by the U.S. government. I mean, this is my fifth pandemic, and they weren't all pandemics, but tuberculosis, HIV, cholera, Ebola, and now COVID. And so in those 5 pandemics, the United States Centers for Disease Control was absolutely critical to every one of those responses. And that, even at the World Health Organization, at the Pan American Health Organization, those places were full of CDC seconded people. And the complete absence of CDC, almost complete absence of CDC from this response is just so painful. I mean, there was an article, I think it was in, I forget which newspaper, but it simply said that for more than 70 years, the CDC has been preparing for this moment. What happened? Well, I don't think there's a simple answer. There's a primary answer. I don't think there's a simple answer, but they've been completely sidelined. So part of it's just rebuilding what we lost, over the last few years. But another part of it is, the world is never going to be the same. We now know that a single virus, an RNA virus, can bring down the entire global economy. And knowing that, what do we do? Before the World Bank, and then when I got to the World Bank, I have been saying, I don't know how many times, nature can bring down civilization as we know it in the form of viruses and also in the form of climate change. Right? And we've seen the one. When are we going to start seeing the other? I think we're already seeing it to some extent. And this requires strong leadership. And one of the other things we've learned is that it requires strong leadership from the United States.
Yep. I mean, so Jim, just to say, we would love to continue to work with you on both the U.S. response, but also as we think of a proactive global response as well. As you say, this is a moment that's changed how we look at this country and the world, and how do we use that. And I also want to say, results volunteers are also very creative. So we've already seen in the chat window people saying, how can we clip out Jim's section about what needs to happen in the U.S. so we can share it with our local health departments? So we'll do that. Or convening members of Congress to brief them about this. I'm sure you're doing some of that as well. But so just to say, we're really committed to continuing to work with you about how do we really ensure a proactive response on this. And just so grateful to you for never seeing something as impossible or not doable, and not being stopped when other people say it can't be, and not just saying it can be done, but showing it can be done and doing it. So thank you.
One thing, seeing the gallery view, it's just so great to see you, and I know how much power you guys wield. If we can possibly get even the 75 billion for testing, tracing, the fact that kind of number is not out there is partly why some of the public health authorities are saying we can't do it, because there's been no money for it, and it makes no sense. It's the worst example of throwing good money after bad. That's what, when growing up in Iowa, people used to say that, right? That's like throwing good money after bad. So another $3 trillion stimulus with nothing for public health is the worst example you can imagine of throwing good money after bad. And so if there's something that we can do together to even just get that 75 billion, carved out and through, that would be great. Because it's not just that we have to support states in doing this, we have to incentivize states to go after this money to support their efforts. And the fact that it's just sitting on his desk, it's sort of every day that it sits there, it's killing people.
Yep. Both here in this country and around the world. So again, we will stay in close touch. We'll bring you back, and we'll figure out ways to work even more closely on this. But Jim, thanks for so much for being with us today and for what you're doing. And absolutely, we are working on moving that bill forward. So just so you know that.
Last word is that my whole team knows that the one group that I never say no to is results. The one person I never say no to is Joanne, and she. Joanne taught me about the importance of dealing with Congress. The very first meeting in the Congress that I ever had in my entire life was with Joanne, and we went to see Sherrod Brown. And it was the first time I ever went. And then she has taught me so much. And I am so impressed with what you guys always do that I'm so grateful to you. Let's really, there's got to be a citizens movement. And the citizens movement is just getting the public health system in place so we can protect everybody, right? The rich people are fine in COVID. They're just fine. We've got to protect everybody. Thanks, guys. Thank you.
Thank you. Thanks so much, Jim.